Hi, everyone. It's good to see you all again and to see some new faces as well. As Katie said, my name is Marlee. I use she, her pronouns. I work for a syringe exchange program in Northern Colorado called the Northern Colorado Health Network. And I work as a prevention services coordinator. So I help run our syringe exchange program as well as provide HIV, hepatitis C, and chlamydia and gonorrhea testing for free to folks. So that's kind of what my day-to-day is. And I'm also a part of the group, the Northern Colorado Harm Reduction Alliance. This is our training that we've created between myself and a lot of other harm reduction professionals in Larimer and Weld counties. Here in Colorado. And yeah, this is just all the information we have on using naloxone and just general overdose prevention. So we will go ahead and run through it with you all. Yeah, I'm going to share my screen. If I can figure out how. Can you all see my screen?
Yep.
Lovely. Okay, cool. Real quick before we dive in, I was just curious if you all can put this in the chat. You can hold up some fingers, whatever works for you. Just curious, on a scale of 1 to 5, 1 being the least, 5 being the most, how confident you all feel in recognizing an opioid overdose yourselves. Cool, I'm seeing a mix, which is totally expected. That's perfect. Awesome. Along with that, same scale, 1 to 5, how do you all feel in terms of confidence in responding to an opioid overdose? Using naloxone or calling 911, all those details. Awesome. I'm seeing we're generally maybe a little bit less confident when it comes to responding, which is great. We'll talk about that today. Final question. How confident do you all feel on that same scale in having conversations with patients about harm reduction and opioid overdose prevention? Lovely. I'm seeing some really confident people and I'm so happy to see that. And again, a real mix. So we'll talk about all this today, and maybe at the end we can have some time for you all to share tips and tricks too, because you all are the real experts. You're the ones doing this every day. So awesome. Thank you for participating in that. It just helps me get kind of a general idea of where we're at. So yeah, let's go ahead and dive in. I'll leave a couple pauses and such for questions that you all might have, but also feel free to put them in the chat anytime, and I'll try to monitor that as best as I can, and we'll have time at the end for questions as well. And just a reminder, you know, as always, like, no question is a stupid question. All questions are great, and you'll only benefit everyone by asking. So please ask away. And yeah, we'll go ahead and get started. If I can change the slide. There we go. All right, so just kind of to establish kind of some ground rules for this conversation. During this training today, I'm going to try really hard to use destigmatizing language. And this is language that, we might have not grown up with. It might feel kind of new to some of us. It might not be like as established necessarily in our medical communities yet, but just language that we're trying to use to make sure that we're coming across as non-judgmental as possible when we're working with patients, because building that trust with patients is so important when it comes to having these conversations and when it comes to overdose prevention. So I will definitely, instead of using words such as addict or drug user, I'll be using person who uses drugs. Instead of calling naloxone a drug, I'm going to call naloxone a medication. And instead of former addict or reformed addict, or, another term that people use, someone who's clean, I'm going to use person in recovery. And then instead of using the term addiction, I'm going to use person with a substance use disorder or problematic or chaotic use. So I just ask that you all kind of try out these terms with me, if you can, if you're comfortable with that, and just see how they feel. And just know, like, language means a lot when we're talking with folks who have experienced a lot of stigma in their lives, from all the different systems they possibly could. So also, we're having this training today for a reason, right? We know that we're in the midst of an opioid overdose epidemic right now in the United States. Here are some statistics. I really need to update this with 2021 numbers. I need to check and see if they're confirmed, but these are the confirmed numbers for 2020. And then also just some numbers. The most recent numbers we have on like overdose costs in Colorado is from 2017, confirmed numbers. So just again, establishing the reason why we're here. This is not something that's just happening to a couple of people in isolated communities. Opioid overdoses are affecting everyone. I think I'm sure that there are probably some folks who have been personally affected in this training today in some shape or form, someone they know, someone they love, a friend of a friend. It's a really big thing. And that's why, we're going to pay attention to, with all of our patients, if there's any need for naloxone, if we can get that to them. All right, so first part, recognizing an opioid overdose. Before I jump into that, I'll check the chat for questions real quick. And if anyone has a question, please jump in.
I can help you monitor the chat too, Marlee, as well.
Thank you. All right, we'll keep going. So, signs of an opioid overdose. Here are some of the most common ones. So blue lips or nails, dizziness and confusion. Our friend might not be able to be woken up. They may be making choking, gurgling, or snoring sounds. They may have slow, weak, no breathing, erratic breathing, and they may be feeling drowsy or just having difficulty staying awake. Going on to rescue steps. So, first things first, as people in the world, right? Like, who knows when we might come across an opioid overdose, right? Anytime that we're noticing some of those signs in someone is a time when we could go ahead and start taking these rescue steps. First one is just assess the situation. You want to make sure that you're safe in your ability to move forward and respond in this situation. If you're not safe, you're not going to be able to help. So that's just number one. First, make sure you're safe. Number two, you're going to check for responsiveness. So for checking for responsiveness, I kind of recommend 2 steps. The first is just a gentle, hi, hello, can you hear me? Are you doing okay? You can tap them on the shoulder. If you're not getting any response when you're checking in there, I would recommend a sternum rub. So as you all I'm sure know, knuckles to the sternum, you can press pretty hard and it's not going to cause like body trauma to them, but it is pretty painful. So if they're able to, they should respond. If you aren't able to reach their sternum easily or you aren't comfortable with that, you can also do knuckles to the upper lip and it has the same effect. If they're still not responding to you after doing that check for responsiveness, time to call 911 and deliver naloxone. And we'll talk about delivering naloxone in just a second. But just another note, if at any time you need to leave this person alone, like you need to go get your phone or you need to go get your naloxone, try to put the person in recovery position. And this is to prevent them from choking on their vomit at all or on their spit, anything like that. So rescue position over to the right here. The most important thing, you just need to get them onto their side. And another point specifically when we're working with folks who are pregnant, if you can get folks onto their left side, that might help increase blood flow to the placenta. So know that as well. And then last but not least, naloxone can take a little while to work. So in between doses, you're welcome to perform CPR if you are trained and if the person is not breathing and doesn't have a pulse. And if they do still have a pulse, you can just do the rescue breaths in between doses of naloxone. So what is naloxone? During an opioid overdose, as I'm sure many of you know, too many opiates are stuck to the receptors in our friend's brain, and that's causing our friend to bodies to shut down so that we're not breathing properly. And what Narcan does, or naloxone, is it goes in and it really quickly strips the opiates from the opioid receptors and fills the receptors instead, so that they can't reattach for a period of time. And this allows someone to breathe again when they're experiencing an opioid overdose. It's important to note that Narcan only works for opioid overdoses. So if someone is experiencing an alcohol or stimulant overdose, naloxone isn't going to be helpful for them. So the type of naloxone that I'm guessing you all have access to is nasal naloxone. It's the most commonly available. It's the type that you would most likely get from a pharmacy if you're just going there as an individual to pick up your right to have naloxone on you. So a couple things to note about nasal Narcan. First, it still works even if someone is not breathing because it's absorbed through the mucous membrane in the nasal cavity. It's easy to carry in your pocket. It's pretty small. It's really easy to administer. It's just as effective as an intramuscular injection version of naloxone. And again, it's the most widely available. And I'm going to reshare my screen so we can watch this video real quick of someone using nasal naloxone. Let's see if I can figure this out. All right.
I'm a pharmacist, and today I'd like to go over
Could you all hear the video just a moment ago? Lovely.
how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what? This is Narcan nasal spray. It comes comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal at the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if the second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
That's it. It's so simple. Just a nasal spray. There are some other things to note about it. So let me reshare my screen to our PowerPoint.
Marlee, can I ask a question?
Yes, please.
If you suspect someone may be having an opioid overdose, but you're not totally sure if it's an overdose that they're going through or if it's an opioid overdose they're going through, is it still safe to administer naloxone just in case?
Absolutely. So naloxone will just have no effect on an individual if they're not experiencing an opioid overdose. They just won't feel anything from the medication. So just know it's safe to use anytime that someone is not responsive or not breathing properly, because even if something else is happening, Narcan is not going to like negatively affect this individual or affect them at all. Great question, Katie. Any other questions while I'm resharing the screen? All right, we'll keep going. So a couple things to note. It can take multiple doses of naloxone to reverse an opioid overdose, depending on the circumstances of the overdose. It's really common for it to take more than 1 dose. So at this point, I would almost expect that. So what that means for you as someone responding to an overdose, you want to, after using 1 dose, wait 2 to 3 minutes for the Narcan to work. If there's still no response from your individual, I would go ahead and use another dose in the other nostril like the video showed. And again, naloxone only reverses an opioid overdose. So if something else is causing this person to be unconscious and not breathing properly, naloxone will not help them, and it also will not hurt them. And then some other notes about naloxone. So first, I'm sure that you all have seen kind of like pop culture representations of someone kind of waking up after an opiate overdose. Just know, like, it can be really traumatizing. It can be really scary for folks. And also their body is going to be feeling really bad at this moment because Narcan puts them into full withdrawal immediately. And so it's definitely advised to give someone a little bit of space, gently welcoming them back into consciousness, usually just like orienting them, letting them know that you had to give them Narcan, you're sorry they don't feel good, and that they're safe, and that you're here for them is great because they're going to be really disoriented. But yeah, a lot of those representations that we see of folks like maybe like seeming acting violently or anything like that isn't necessarily true. It all kind of depends, right, on how we are orienting them when we're welcoming them back into consciousness. So just know, like, this is a really important part, and it may seem simple, but when it's an emergency, it can be really stressful and we can do things that we don't expect to do. So good to keep this in mind. The other note on here is to try to stay with the person for 90 minutes after they've woken up from an opioid overdose. The reason for that is just Narcan doesn't last forever, right? So it only fills the opiate receptors for 30 to 90 minutes after an opioid overdose. after that time, that person could go back into an opioid overdose, depending on the circumstances of the overdose and depending on if they've used again, kind of once they were in that full withdrawal. So just want you to be aware of that. And also it's really important to tell your patients that as well, just so that they can like have kind of a safety plan and hopefully get some further medical care. But if they decline that, at least have a safety plan and have someone with them to administer more Narcan if they need it in the near future. All right. Any questions about responding to an opioid overdose or naloxone in general?
Hi, this is Callan. I have a quick question. In terms of a pregnant person who may be having a suspected overdose, is there any data I know that withdrawal can be really dangerous for a fetus, and just wondering if there's any data around like special considerations or certain steps to take if the person you're administering naloxone to happens to be pregnant or is suspected to be pregnant?
Mm-hmm. Excellent question. So currently best practice is to use naloxone on someone who is pregnant or suspected to be pregnant in the exact same way you would use naloxone on anyone else. The reason for that really just is like, this is a life-saving medication. So we do know that, you know, with that instant withdrawal is not helpful for the fetus, but it's just the best that we can do in this life or death situation. And the most important thing is that we keep them both alive by using naloxone. I'll get to that in just a second here. The National Harm Reduction Coalition, they actually have a whole like workbook for harm reduction and people who are pregnant. So I will make sure to send that over to Katie and Elena so you all can have access to that, but it talks about best practices around in general, talking with folks who are pregnant around substance use, and then just using naloxone as you would on any other person with a person who is pregnant. Great question. And that's also obviously why calling 911 and getting that person some further medical care is desirable if possible. Any other questions?
This is Kaylin. You might have addressed this and I joined a few minutes late. I apologize. Could you comment on, you know, sometimes, especially with healthcare providers, I've heard some people who were worried because they felt like administering medical care in an uncertain situation, could they be liable for any bad outcomes? Did you talk already about like Good Samaritan laws and bystander law protection?
I haven't. That's actually my next slide. So we'll go ahead and jump over to that. Great question. So in the state of Colorado, we have the Good Samaritan law, which protects anyone using naloxone and anyone who has overdosed or may have overdosed from any drug or drug paraphernalia charges. It also protects you. It's like the same protection as a bystander as doing CPR on someone who's unconscious. Even if this person, something happens and the naloxone doesn't work and this person ends up passing away, you're not liable for that because you did the best in this situation. Yeah, that's definitely covered in the Good Samaritan law. That is covered in the Good Samaritan law all throughout the US, and then specifically the drug and drug paraphernalia possession charges are covered in the state of Colorado as well. So that's really good information for you all to know as people in the world, and really good information for you to tell patients as well who might be concerned about calling 911 when responding to an opioid overdose, because they're worried about any charges that could make it difficult for them and their families to move forward. So yeah, so just know the Good Samaritan law doesn't protect from other crimes, such as other crimes at the scene, parole violations, child protective services, etc. And this is also really good information to tell your clients, because we want them to ultimately make the decision that's the safest for them. Hopefully calling 911 is the safest option for them, but if they choose not to, we want to make sure we have the information about those consequences so they can make an informed choice. I have heard a lot of anecdotal pieces from clients recently that even if there's a parole violation or another crime at the scene, or a reason for child protective services to get involved, that law enforcement has not been pursuing that when folks are calling 911 in response to an overdose. And it has been, for most people in their recent experience, primarily just how can we get this person further medical care and how can we keep you all safe? So that's really good to know. I almost never hear of complaints about the Good Samaritan law not being helpful for folks. So. And then another note, as we talked about earlier, for opioid overdose and pregnancy, the National Harm Reduction Coalition, the experts on using naloxone in the United States, recommend responding to an overdose in a pregnant person exactly the same as anyone else. Another myth-busting item around naloxone. So a common question from the community is if naloxone enables substance use in any type of way. And the fact is that naloxone has not, there's been no evidence that it having naloxone available and accessible leads to increased substance use or increased risky substance use in any type of way. It's essentially just like having a fire extinguisher, right? When we have a fire extinguisher, that doesn't increase the chances that we're gonna experience like a fire, but it doesn't encourage a fire to start. It's just there if we need it to help respond. So yeah, so just important things to keep in mind, especially, you know, like if you are talking with patients about this, you might hear some views of naloxone that you may or may not agree with, and some myths about it, and just being able to provide those facts is really important in overall reducing stigma and getting people the medications that they need. Last myth to discuss. So there's kind of a myth out there that only opiate users need naloxone. The fact is, anyone using any illicit substance could experience an opioid overdose due to the prevalence of fentanyl being in pretty much every drug in the illicit drug supply, particularly meth, cocaine, and Molly. I'm sure that you all have seen fentanyl in the news recently. It's quite an issue at the moment, but due to whatever reasons, might they be like intentional cross-contamination or unintentional cross-contamination, meth, Molly, and cocaine often have fentanyl in it, and someone might still experience an opiate overdose after using one of those substances. So it is really important to make sure that if your patient or anyone in their family or like close friends, if they're using illicit substances in any shape or form, they could benefit from having naloxone, and that could potentially save someone's life. And more on fentanyl. It's an opiate that's 50 to 100 times more potent than heroin, appearing in the illicit drug supply in general across the United States. All right, any questions on any of those myths that we busted together? Or anything else you've heard about naloxone that you're wondering if it's true?
I have maybe an odd question. I'm new to this world. But I saw a couple providers. I'm not sure if they work here in Colorado or not. This was just on Twitter, so like very informal. But they were saying how when they tried to carry naloxone on them, their insurance basically like considered them risky people because they carried naloxone, even if it's not for them. They just wanted to carry it for situations like this. Is that, I guess, like, is that a real thing that people actually have to think about, or is that kind of a one-off able?
Great question. It is unfortunately a real thing that people have to think about. The good news is that in Colorado, this hasn't happened. And the state of Colorado is prepared to fight back on that kind of mistreatment by insurance companies. So just know like you are protected here and it hasn't happened here yet. And hopefully will not happen in the future. And if it does, the state of Colorado is ready to combat that for you.
Awesome. Okay. That sounds like the rational way to approach things. So I'm glad.
Yeah, it's so unfortunate that it's happened, but it has. And it really is truly a bummer because, you know, the best person to respond to an opioid overdose is someone who isn't using opiates at that moment, right? So ideally, like best practice, everyone in the world would carry naloxone with them at all times and be able to respond to an overdose. So hopefully we get some more protections throughout the United States to make sure that that's possible for folks. And some other questions in the chat. So Heather asked if we use fentanyl test strips and have them available as well. We do. Fentanyl test strips are widely available through the state of Colorado at every syringe access program in the state. And we give them out here. I'm not sure if fentanyl test strips is an option for you all to give out for and kind of along with naloxone. That could be something to look into. They work really well. If you haven't heard of them before, they're used to test your substance before you use it to see if there's fentanyl present in your substance. Unfortunately, it doesn't tell you how much fentanyl is present. And there is definitely risks for false positives as well as false negatives, but it's a tool we have and it's the best one we have right now for people using drugs. Excellent question. I do not know of any resource for providers to access fentanyl test strips at the moment. I'm curious, Katie or Elena, if you do. I do know we will give out fentanyl test strips to organizations from the syringe access program. So we have provided fentanyl test strips for different organizations that work with the unhoused population across our county. And I would definitely be interested in providing fentanyl test strips for any providers who are interested in that as well. I think that would be a really awesome way to engage with patients for you all. But yeah, I'm not aware of any resources or current programs
One thing we can do, so I'm talking next week to the Colorado Naloxone project anyway. And that is the project through which some of our L&Ds on this call are dispensing naloxone. I will ask them more about fentanyl test strips and like how hospitals might be able to get them. Because I feel like they would be the best people I know to ask. So I will report back after I talk to them on Tuesday.
Awesome. That's super helpful. They also are available online. They just can be kind of pricey. So it's not necessarily super accessible to everyone, kind of individually to individual patients. But that is an option for y'all's hospital budgets. So yeah, I'm curious if you can also get them through the Naloxone bulk fund. But yeah,
So
Katie.
hospitals can't use the naloxone bulk fund.
Oh.
Only like community agencies can use the naloxone bulk fund. So that is why I'll ask the Colorado Naloxone Project because they're working on this. Also, I'm curious if anyone on the call, I know that the fentanyl bill was just passed in the last couple of weeks. So if anyone knows what that might mean for all of this, I would love to hear that because I think it will significantly expand access to naloxone for hospitals and providers, but I don't, because it'll be reimbursed or something, I don't totally understand the details. So if anyone does, I would love to hear about that.
Yeah, that's a great point. I wish I understood all the details of that, but I also don't. But it's definitely clearly a priority of our legislators right now, which is extremely helpful. Also, Marlee added something into the comments about how naloxone should not be stored in a hot car, which is great. I think I have a slide on that at some point in here. So we'll talk about that, storing naloxone, best practices for that as well. Awesome. All right, great questions, you all. I'm gonna keep diving forward. So in general, when we're having overdose prevention conversations with patients or with other folks in our lives, really, it's helpful to think about those conversations in the context of harm reduction. So harm reduction, broadly defined, is a set of practical strategies and ideas aimed at reducing negative consequences associated with fill in the blank. So harm reduction is really actually like a very normal part of our lives. Harm reduction is condoms, seatbelts. Harm reduction is face masks during the pandemic. All of those things are kind of included in harm reduction with Narcan. So just know, I think sometimes it can feel like kind of a far away concept, but it's already something that we're engaging with every day. And then just a couple of kind of tips to keep in your toolbox of skills for having these conversations around naloxone and overdose prevention. Definitely recommend person first language, like we talked about in the beginning, just making sure that we're using the most respectful and non-judgmental terms when we're talking with our patients, even if our patients are maybe using some terms to identify themselves that we wouldn't use to identify them. That's okay. We just want to make sure that we come across as least judgmental as possible by using person first language. Second tip is unconditional positive regard. So just recognizing that each and every person at every moment is doing their best to take care of themselves and their families. Just, understanding that someone taking care of themselves might not look the same as you taking care of yourself, but they're still trying their best to take care of themselves and their families at all times. And we know that substance use can definitely be a coping mechanism that can be really, really helpful for folks in a lot of ways. Also, reflective listening, which is a piece of motivational interviewing, which I would encourage you all to check out if you aren't familiar with it already. But reflective listening is really just reflecting in our language what patients are saying to us. So that kind of holds space for people in their contradictions, and lets people kind of work through maybe reasons why they are opposed to having naloxone on them, and is just making sure that you know that your patient, or making sure that your patients know that you're really listening to them, and you're listening to kind of the struggles that they are dealing with when it comes to substance use and naloxone. Also, another part of motivational interviewing, using affirmations. So making sure that you're reminding folks that they are absolutely doing their best at all times, and finding the positives and how they are taking care of themselves and their families, to make sure they know that you know that you are that they are trying their best. That really, really helps with destigmatizing, which can really help build trust between you and your patients, as I'm sure you all know. And then lastly, just understanding that relapse is a very, very normal part of recovery. Relapse rates specifically for opioids are as high as 80 to 95% during the first year of treatment, and they go down slightly after that, but still very high. So just know someone in recovery will most likely relapse at some point in their recovery. And anything that we can do, that trust that we have with them, will help them continue to engage with the medical community in general, and making sure that they have naloxone in preparation potentially for a relapse is really helpful, because relapse is associated with really high overdose risk, just because that person's tolerance is a lot lower than it used to be. If you all are comfortable with it, I would definitely recommend opioid overdose safety planning with your patients. So just a couple of tips that your patients most likely already know, but it could be really nice for them to know that you know about these and you care about them in the harm reduction kind of perspective too. So trying not to combine substances. When we're using alcohol and benzos along with opiates, they can have a synergistic effect. So 1 + 1 doesn't equal 2, it actually equals 4, and we didn't expect that. So making sure folks know about that. Same with folks using uppers and downers. So maybe using heroin and also using meth. If they're mixing, they should use opiates first, just because they'll get kind of an accurate judgment of where their tolerance is with that. If they use the stimulant first, they might not really feel the effects of those opiates, and they might kind of add up over time, and just creates an increased risk for opioid overdose. Another thing to note, prescription pills doesn't always mean that you are safer, especially if you are not getting your prescription from a pharmacy, but from someone else. The most common substance out there right now are fake oxy pills that are actually mostly fentanyl. So just making sure folks know that if they're getting oxy from a friend, it might actually be fentanyl, most likely. So they should be prepared for kind of a more intense medication than they were expecting. And then also starting low and going slow, being aware of tolerance, periods of abstinence, real-time rehab can all affect tolerance, and you can always add on, but it's a lot harder to take off. So just some harm reduction tips that can let folks know you're thinking about them while they're in this space of using or might use again, because they're in recovery or not quite yet in recovery. Katie added in the chat that fake Xanax and Adderall with fentanyl have been very common lately. Absolutely true. Any street substance is most likely going to have fentanyl in it at this point. It's really common. So just making sure that folks know that. Some other tips and tricks. As we talked about, fentanyl testing strips are a really great tool. If your substance does test positive for fentanyl, there's lots that you can do with that information. So you could do a tester shot before using the full amount. You could smoke or snort instead of injecting. You could throw that away and use from a different supply that's negative for fentanyl. You could have a friend with you who's prepared to use naloxone if you overdose. Lots and lots of things that aren't necessarily that you're not going to use that substance. So just know, like, if folks are asking you all what to do if their substance has fentanyl or they think that it might have fentanyl, making sure that they know that they have lots of options other than just not using the drug, because sometimes that's not always an option for folks. And then the biggest thing when it comes to overdose safety planning, just letting someone know that you're using and trying not to use alone is huge, because you will rarely be able to use naloxone on yourself. If you are, you're probably using it a little too early. You might not need it. So you really do want to have someone with you who can use naloxone on you if need be. There's a really cool option called Never Use Alone. They're a hotline run by people who all have lived experience of substance use. So they're super non-judgmental, which is amazing. Folks can call this number, provide their first name, the location, and their phone number. And then they can use while on the phone with Never Use Alone. And just if they stop responding after using, Never Use Alone will contact emergency response and let them know your location and that it's a possible overdose. So that's one great tool for folks who might not have someone with them when they're using. And just in general, as we've been talking about throughout this whole training, the real goals of this conversation, beyond just keeping everyone alive and safe in their daily lives, is to, reduce the negative consequences associated with substance use, which will increase trust and improve engagement with patients, and ultimately really improve individual and community health. So just know that having these conversations is really important in the big picture about just building trust with the medical system and increasing that engagement. All right. Any questions on that section? Anything that's come up for folks? All right, we'll keep moving along. Next, we're just going to talk really briefly about where folks can obtain naloxone and other harm reduction resources. So in the state of Colorado, there's a standing order on naloxone, meaning that anyone can legally obtain it from a pharmacy. You don't need to have a prescription. Anyone can get naloxone from their pharmacy. It's usually about a $20 to $30 copay if you have health insurance. So just good information for you all to know for yourselves and for anyone else in your lives, and for your patients too, to make sure that they know this. And then again, other opportunities for getting naloxone, pharmacies, definitely would recommend your local syringe access program for the most, the lowest barrier access. And there's also a national naloxone mailing program. So if someone you're working with lives far away and isn't able to access a syringe access program in their kind of general area, there's a national mailing program that will mail them naloxone to their address. some different places that you all can learn more about harm reduction and that your patients can learn more about harm reduction. There's a list of Colorado harm reduction organizations. The one that I work for, Northern Colorado Access Point and Northern Colorado Health Network, we go by both names. And then also the National Harm Reduction Coalition has great information on their website. We talked about this, but this slide is all about life insurance being negatively impacted from obtaining naloxone from a pharmacy. Again, the Colorado Division of Insurance is ready to protect you, and this has not happened in the state of Colorado up till now, which is great news. And then lastly, storing naloxone, as Mari mentioned in the chat, ideally, if you can, you want to keep naloxone at room temperature. However, if it's easiest for you to always have naloxone on you by keeping naloxone in your car, that's okay to still do. Some naloxone is better than no naloxone at all. It might slightly decrease in efficacy, having been exposed to extremely hot or extremely cold temperatures staying in your car, but it's better than no naloxone at all. The same goes for expired naloxone. It might slightly decrease in efficacy, but it's been proven to work well beyond its expiration date. There's been studies that show that it works up to 30 years after expiration. And so just know that, again, some naloxone is better than no naloxone. So whatever works for you and making sure that you have it at all times. And yeah, that's it. I'm going to stop sharing my screen real quick and see. I have a couple of resources to show you all that I will send out to Katie and Elena, and they can send to you all. But also, what questions do you all have? And also, if anyone has had really amazing conversations with patients that they'd be able to share, or any tips and tricks for those. Cool. I'm going to pull up some resources real quick for us in our last couple of minutes. Okay. So just some resources that you all can share with patients. We have a little fact sheet about the Good Samaritan law that you can give out when you provide naloxone. So that's great for folks to have, as well as we have kind of a double-sided sheet on all the syringe access programs in the state of Colorado, their address and their phone numbers, as well as other details about where one can get naloxone. So this is something else that you all are welcome to share with patients, especially if you all are limited in the amount of naloxone that you can give to patients at a time, because they might need a refill at some point. So just making sure they know of those other resources. We have these handy little business card sized cutouts for never use alone that you're welcome to hand out to patients that have that information, so that if they are in a situation where they need to use alone, they can stay as safe as possible and still have someone monitoring their response. And this here is the toolkit on pregnancy and substance use from the National Harm Reduction Coalition. And so I would definitely recommend you all reading this. It has amazing takeaways, and it is really helpful just for your own knowledge. if you haven't checked it out already. Some other things that we have a little safety plan that you all can use when you're working with patients. So it has some general tips and tricks for staying safe. And then at the bottom, there's some information you all can write in so you can plan with your patients where they'll keep their naloxone so that they can have it at all times when they would need it, who they're going to contact for support and who their kind of emergency contacts are in case of an overdose, and then what local resources they can continue to access in order to keep staying safe. All right, I'm looking at the chat. I would love to open that, but my computer's being weird, but you all should check it out for sure. Yeah, it's so hard to tell the difference between prescription pills and counterfeit pills. They look so similar. Cool. I know we only have like 2 more minutes or so. We can do a quick post-assessment if you all are up for that, but I do want to give space for anyone who feels really comfortable having overdose prevention conversations to share kind of how those conversations have gone.
I just had a question about the resources you just shared. Sorry, what was the website to access all those?
I'll send you.
You're gonna send them. Okay.
Yeah.
Yeah,
I don't.
we'll put them in
so
the team. We'll put them in the team resources folder, Amanda.
Awesome.
And since we just have a few more minutes, I have a post-assessment survey that I'll send out. But thank you so much, Marlee, for presenting. We really appreciate you coming. And we'll follow up with all the teams with a follow-up email. But thank you so much, Marlee, for presenting. Again, this was such a great presentation and so informative. And we're so glad that everyone was able to come today. So I'm gonna put up that evaluation poll. So if you have a chance, please fill that out. And we hope everyone has a great rest of their day.
Thank you all.